Chapter 5 Complementary and Alternative Therapies. Complementary and alternative medicine includes everything from botanicals, nutritional products, and herbal supplements. They can possess both positive and negative effects, and unfortunately can also interact with both prescription and over the counter drugs. There are currently lists of clinical trials with herbal products, but as you'll see, many of these products can also often be unregulated. The Dietary Supplement Health and Education Act of 1994 defined a dietary supplement as one intended to supplement the diet, one that contains one or more dietary ingredients. It's intended to be taken by mouth and labeled as a dietary supplement. The labeling requirements include things like the name of the supplement, the amount of the supplement, the nutrition labeling, the ingredient list, as well as the name and place of the manufacturer, packer, and distributor. Under current good manufacturing practices, these standards require package labels to declare the quality and strength of contents, and that the product is without contaminants and impurities. There is a seal of approval awarded to products that do meet this specific criteria. Commonly used herbal remedies include things like Asian ginseng that increases resistance to environmental stress, as well as improves well-being. Other supplements such as chamomile that's used to relieve anxiety, sleeplessness, digestive complaints, skin conditions, and oral ulcers. The side effects range from mild allergic reactions to anaphylaxis. Echinacea can be used for colds, flu, infections, and stimulates the immune system, with side effects including GI effects and allergic reactions. Garlic can be used to lower cholesterol and blood pressure, as well as reduce heart disease, prevent stomach and colon cancers, though it does have side effects including things like heartburn, upset stomach, and decreased blood clotting. Ginger is used for nausea, motion sickness, diarrhea, relieving pain, swelling, and arthritic stiffness. The side effects may include gas, bloating, heartburn, and nausea. On the other hand, ginkgo biloba is used for anxiety, allergies, dementia, eye problems, tinnitus, and peripheral artery disease. Studies have been conflicting or unreliable on its usage, and other side effects include headache, dizziness, nausea, increased bleeding, and allergic reactions. Lavender can be used for anxiety, depression, and digestive symptoms, though no high quality studies have been shown to demonstrate its effectiveness. Saw palmettos can be used for urinary problems, everything from benign prostatic hypertrophy, BPH, to chronic pelvic pain and hair loss. Side effects include digestive problems and headache. St. John's wort is a very commonly used supplement and one we're going to talk a lot about next semester in mental health as well. St. John's wort can be used for depression, menopausal symptoms, ADHD, somatic symptom disorder, and OCD. It interacts with some medicines and can be in a dangerous or life-threatening manner, especially when we start talking about SSRIs and antidepressants next term. Side effects include things like anxiety, dry mouth, dizziness, headache, fatigue, sensitivity to sunlight, GI problems, and sexual dysfunction. On the other hand, there is turmeric used for heartburn, stomach ulcers, gallstones, though high doses may cause nausea and diarrhea. There are many potential hazards of herbs. These are natural substance does not mean it's safe. And herb-drug interaction is possible. Herbal products can affect everything from lab results, and not all compounds are safe via all routes. Also, many products may interfere with things like absorption, breakdown, and excretion of anesthetics, anticoagulants, and other drugs used in surgery. Make sure to discontinue any herbal therapy 2 to 3 weeks before surgery. For consumers and healthcare providers, do not take if you're taking prescription drugs without checking with the healthcare provider. For us as nurses, that's why it's so important to have that accurate med rec. We want to include everything the patient's taking, everything they're prescribed, everything they're taking over the counter, and any herbal supplement that they're taking. You also want to advise the patient, not to take if pregnant or nursing. Don't give herbs to infants or young children. Follow the label instructions and discontinue if side effects are disturbing, and contact healthcare provider. We need to recognize cues and identify all prescriptions as well as over-the-counter drugs, assessing for drug, herb, supplement side effects, making sure that everyone is aware of exactly what this patient is taking. We also want to identify any need for health teaching. And for solutions, let the patient verbalize their understanding of the herbal therapy, prescriptions, and the over-the-counter drug combinations that they may be using. When taking action, advise the patient to notify a healthcare provider before substituting herbs for a prescription or over-the-counter drug. Encourage the patient to read labels and read recommended information. Also, teach the patient about foods that can enhance or diminish the action of a specific herb, while advising the patient of any potential side effects of the herbal therapy. For our first practice question, what are our 4 guidelines that the nurse should teach the patient about the use of herbs? That be A, do not use herbs if pregnant or nursing. B, may be given for children 2 years of age or older. C, seek care from a healthcare provider for side effects. D, read labels and follow requirements. Or E, consult the healthcare provider about other prescription and over the drugs before starting the herb. And that answers are going to be A, B, C, and D. A, do not use herbs if pregnant or nursing. B, seek care from the healthcare provider for side effects. C, read labels and follow requirements. And D, consult a healthcare provider about any other prescription and over-the-counter drugs before starting the herbs. Which statement about St. John's wort is true? That be A, current research suggests that there is no more effective than placebo when used by individuals with depression. B, side effects include hypotension, breast tenderness, menstrual irregularities, and hypoglycemia. C, St. John's wort has been approved by the U.S. Food and Drug Administration to treat depression. Or D, users of St. John's wort should avoid tyramine-rich foods while taking this supplement. That answer is going to be A. Current research suggests that it is no more effective than placebo when used by individuals with depression, though this is a very, very commonly used supplement that a lot of people swear by. Again, I don't recommend CAM therapies. I don't discourage CAM therapies. Make your own decisions. Which herb is thought by some to improve memory associated with aging? That be A, ginger, B, valerian root, C, ginkgo biloba, or D, echinacea? And that answer is going to be C, ginkgo biloba. Before beginning herb therapy, which of the following herbs should the patient inform the healthcare provider when the patient is receiving an anticoagulant secondary to previous blood clots? Would that be A, garlic, B, echinacea, C, valerian root, or D, peppermint? And that answer is going to be A, garlic. CAM therapies are something you're going to see more and more of. It's no secret that Western medicine, modern medicine, has many people skeptical in some areas. It's also extremely expensive. And a lot of people are looking for alternatives to this, whether with positive or negative effects to that. Like I said, for our patients, we neither encourage nor discourage these CAM therapies. We try to provide informed consent. We try to provide as much information as we can to allow the patient to make their own decisions. For us, our top priority is to make sure that we're getting that accurate med rec. We are getting that medication reconciliation so that we have careful documentation of everything that patient is taking so we can identify any potential interactions before further medications prescribed. But anyway, that's all we got for this chapter. I'll see you in the next slides.